Health inequities or disparities are about differences in health between different groups. For example, First Nations people have, on some measures, worse health. They live shorter lives, higher infant mortality rate. But what's more is that those we know are avoidable differences and correctable differences. So they're unfair, they're unjust, and they're correctable. And that's what makes it inequitable. What we know about marginalization and exclusion in our society is that wherever people are marginalized or excluded, they are going to have worse health. It particularly applies to visible minorities, so the various immigrant groups, people with physical handicaps, people from First Nations communities, all are in that category. But then we have the added dimension with First Nations where they've also been robbed of their resources, and they've been robbed of their heritage and been systematically excluded through colonialism, residential schools, and racism.
Health inequities are understood to be gaps in health that are created through policy, and therefore are avoidable. So if you chose a different policy, you could have a different result. And because they're avoidable, they're unfair and unjust. The answer to health inequities or gaps that are a result of unfair, unjust policies is to adjust the policies to work upstream. Needing to understand these health gaps as a result of previous government policies, I think, again, smoking is a really good example. Some of the things that we know about smoking is that if you have lower educational rates, you're more likely to start and to continue to smoke. If you live in a low-income neighborhood or yourself live in a low-income household, you are more likely to smoke. If you have experiences of trauma in your childhood, such as abuse, you're more likely to smoke and use other substances as well. So we know that poverty in this province is highly racialized, and Indigenous peoples are far more likely to live in low-income settings. It's not enough, though, to just say that Indigenous people are more likely to live in poverty. We need to understand which policies have led to that, historic and current. So we need to understand that when the treaties aren't honored, protecting First Nations access to their own traditional lands, that leads to poverty. When reserve communities are settled on inferior lands without economic bases or opportunities for development, that leads to poverty. I also think then that the way we approach something like smoking rates can't be just through targeted behavior change messages to Indigenous peoples. We have to look at those root causes of how Indigenous poverty was created, and really our treatment needs to be focused on the treatment of poverty, and again through policy mechanisms and structural mechanisms.
The government needs to start talking to the Inuit organizations, the Inuit on the ground. Look at the Aboriginal Peoples Survey. Look at our health outcomes. Look at our socioeconomic data. That tells you where we need help. You know, we've got the highest suicide rates in the world in Canada. We've got the highest, lowest income in Canada. We've got as an Inuit male, I'm going to die 10 years earlier than a Canadian male. And the women are going to die, Inuit women die, I think, 7 years earlier than the average Canadian female. So we don't live like Canadians, and we don't die like Canadians.